Critical thinking. A client's problems don't often follow the textbooks. They're very individual. Clinical decision making enables nurses to take unclear problems and through the nursing process find solutions that will benefit the clients. This is what separates nurses as professionals. Critical thinking requires the nurse to consider what is important in each situation, imagine and explore alternatives, consider ethical principles, and make informed decisions regarding the care of the client. It helps you see the big picture from all possible perspectives. Critical thinking is based on evidence-based practice. Critical thinking skills include interpretation of the data collected. You've got to clarify those muddy points. Analyze the data collected. Don't make assumptions. Inference. Look at the meaning and the significance of your findings. Evaluation. Evaluate your interventions. Explanation. Use your knowledge to support your findings and conclusions. And self-regulation. Reflect on the experience. How can you make it better? Remember, you will never know everything. Thinking and learning critical thinking is going to help you anticipate client needs and potential problems. There are several levels of critical thinking, actually 3. The basic, it may require a conscious effort. You have to use manuals due to minimal experience. You're unable to individualize care or problems, and you learn to accept diverse opinions. This is where you are now. Complex, you have more independent thinking. You analyze and examine choices. You think more creatively and innovatively. And you understand that there's a variety of different approaches for the same therapy. And commitment. You anticipate when to make decisions and take accountability for the decisions that are made. It's an automatic response, and this is basically what you consider your expert nurse. The general critical thinking competency involves scientific method, which is systematic, ordered approach to gathering data and solving problems, your research. Problem solving, which is obtaining information and using it with what you already know to find a solution, and it also uses evaluation. And decision making, which focuses on problem resolution involving recognizing the problem, assessing the options, and making a decision. And then your specific competencies. Diagnostic reasoning and inference is an analytical process for determining the client's problems and drawing conclusions. And clinical decision making requires careful reasoning and selecting care based on clinical knowledge and client data. The nursing process is used to diagnose and treat actual or potential problems. Nurses become very skilled in the nursing process and move from one step to the other without even thinking about it after they've gained some experience. The critical thinking model helps improve care provided and helps decrease errors that might be committed. I highly recommend that you review Box 15.3 and Table 15.3 in your book. You must learn how to connect knowledge and theory with your practice. Application of knowledge is the key to nursing. You can do this with reflective journaling, which is thinking back on an episode and reviewing actions that have been taken and determining if those outcomes could have been improved with different interventions. In other words, what could I have done differently or better? Meeting with colleagues. In other words, draw from one another's experience. Never turn away the resource of your colleagues. And concept mapping. Concept mapping is a visual representation of client problems and interventions that show their relationships to one another. It helps synthesize data to organize information to form meaningful patterns.